Okay, now another question that we get almost daily is what are the symptoms of low testosterone? So if you've had a lab test and or you're going through a checklist online somewhere or taking a quiz, they're going to ask about symptoms like fatigue and decreased libido and erectile dysfunction and weight gain and lack of response to exercise and trouble sleeping and difficulty concentrating. So all of these can be symptoms of low testosterone, and there are others as well. It's important to keep in mind, though, that just because you have these symptoms don't necessarily mean that you have low testosterone. These symptoms can be seen in many other disease processes, or sometimes not even a disease itself. So it's important to marry up not just these symptoms, but also the low numbers. So I want to take a moment, though, to delve into these a little bit faster, or deeper rather. So if you are looking into the symptoms of low testosterone and you're just checking boxes and you say, yeah, I'm fatigued, well, it's important to, again, know what that really means. So the kind of fatigue that you'll typically see if you have low testosterone is something that gets worse typically throughout the day. When testosterone is made naturally, the levels are going to be highest in the mornings and they fall throughout the day. So that fatigue often increases as the day wears on. So this can be a reason why you might feel that you're more of a morning person now than you used to be, because by the end of the day you're run down, you're tired, you're irritable. That all can sometimes tie into the fatigue associated with low testosterone. Decreased libido. Often libido gets mistakenly put in the same category as erectile dysfunction. And while they are somewhat linked, they are separate. So libido is that biological urge toward intimacy. That's something that's far different than just the mechanics of gaining and maintaining erections. So if you find that sex and intimacy are on your mind less, to the point where it's maybe even causing issues in a relationship, then it's something that you really need to take note of. That's something that shouldn't happen to guys in their 30s, 40s, and 50s, and often when that is noticed, that can be related to low testosterone levels. For erectile dysfunction, this is something where if you're just talking about low testosterone, usually we're dealing with quality issues. Not necessarily the inability to obtain an erection, but rather to maintain an erection that's satisfying for you and your partner. So the quality of erections has probably more to do with it. Remember that the mechanics of obtaining and maintaining erections is really more about the vascular performance of the body. So blood vessels have to clamp in the right spots and open up in the right spots for this to happen. But there also is that psychosocial portion that's tied into libido that has to do with erectile functioning. The role of testosterone in erectile function is actually relatively small, albeit important. So again, you just want to make sure you're looking at the right symptoms here. When it gets to lack of response to exercise and weight gain, these are of course also going to be interrelated. What you'll see when your testosterone levels are low is a difficulty in building muscle mass and maintaining muscle, and it also becomes easier to pack on weight around the midsection. Of course, that's typically just fat mass. So now you have this imbalance between fat mass and lean mass. And when you get back into the gym, when you're trying to do what you need to do to lose the weight, if you're not gaining muscle, or at least maintaining what you have, then it becomes harder to improve your body composition. Because as you gain muscle, you burn more calories. Well, if you're not gaining more muscle, you're not burning more calories. And then it becomes really difficult to respond to exercise the way that you used to when your testosterone levels were normal. Trouble sleeping. Somebody who has difficulty initiating sleep, if you can't shut your brain off at night, you feel like you have insomnia and that's just something that you wrestle with, testosterone is probably not at fault for that. However, if you feel like over the last months or years that you were able to initiate sleep fine, but you're sleeping less soundly and you're having trouble waking up in the middle of the night and not being able to fall back to sleep, that often is something that we see with low testosterone, that your quality of sleep diminishes. So you're not getting that restorative sleep that you used to, you're not getting into the latter stages of sleep. So that kind of trouble with sleeping is something that can be associated with low testosterone. And then finally, difficulty concentrating. Mental cognition is something that is closely related to this as well. Sometimes it's people's primary symptom. I have men who have come to me who have really no issues with the other things that we see, but they've noticed that their word finding capability has suddenly left. And we're not talking about the kind that you get with Alzheimer's or some other dementia, but rather we're dealing with something that if you're giving a talk on something that you do every day, if you're a salesman and you're going through your normal sales pitch and you can't seem to focus, yet you're sleeping the way you should, you're eating the way you should, sometimes that can be related to low testosterone. So it's important to take note of all these symptoms, but don't just check boxes. Think about how it's really impacting your life and talk about that with your provider. It's extremely important that the symptoms are there. If you're trying to determine if you have low testosterone, you're not going to know the answer just based on the quiz, nor are you going to know the answer just based on the lab test. Both of them have to be looked at carefully. The provider who's evaluating you for low testosterone should be looking at your medical history, conditions or events that may contribute to the same symptoms and or low testosterone, and then of course balancing out symptoms, treatment, risks and benefits, and talking about that all together. So next we're going to be talking about how you intervene in this and a little bit more about the levels of low testosterone and how these different modalities of treatment can affect your levels long term. Thank you for listening.